The Cardiac Care Network serves as an advisory body to the Ministry of Health and Long-Term Care in relation to the delivery of adult cardiac services in Ontario. Recently, it was asked to compile an inventory of congestive heart failure services across the province. It is widely known that a gap exists when treating congestive heart failure in a hospital environment versus treatment in the community. Hospital care is very expensive and is not always the right approach at the right time for a congestive heart failure patient. The numbers are alarming. Heart disease is the #1 killer of Ontarians. 5% of Ontario patients consume about 60% of available healthcare funding. The cost of treating congestive heart failure in the hospital environment is a minimum of $12,000. And if there are other health issues involved, it can easily rise to $42,000. There is a strong argument to be made for specialists to treat congestive heart failure outside the hospital whenever possible. This includes both prior to hospital emergency services being needed and in the recuperative stages following. For the last 2 years, the Ontario Association of Cardiologists has been working on something it calls the Congestive Heart Failure Regional Hubs Initiative. The OAC believes that if adopted by the ministry, this concept would provide more accessible care to Ontarians, save money, save lives, and vastly improve the quality of life for congestive heart failure patients. OAC cardiologists Dr. Heather Ross and Dr. Mike Hartlieb are actively involved.
Heart failure is a condition where the heart is not pumping adequately to meet the needs of the body. And as a result, patients would typically feel fatigued, short of breath.
It could be something that is so severe that patients can't carry on their day-to-day activities. In fact, need to be hospitalized because of the severity of their symptoms.
Heart failure is an epidemic. There are approximately 500,000 Canadians with heart failure. It's the single commonest reason that a patient comes to the emergency room. It's the single commonest diagnosis for admission to hospital. And right now, heart failure in Canada accounts for approximately $3 billion of healthcare expenditure. And moreover, probably the most concerning thing is the average life expectancy after a diagnosis of heart failure is 2.1 years.
There is no cure for it. It can be managed, and a lot of congestive heart failure can actually be managed relatively simply. A lot of heart failure patients were just kind of falling through the cracks, that they would leave the hospital and they would come back very shortly thereafter because we just hadn't coordinated ourselves in such a way that allowed them to ensure that they had the follow-up that they needed. In terms of resource utilization, hospitalization is a very, very expensive way to deliver care. Much of what we actually do in the hospital can actually be done in the community if you look at it in a unique way. And the goal is to make sure that patients never get hospitalized if we can avoid it, to make sure that if they land in the emergency department, we provide an outlet so that they can be seen outside the hospital setting. And if they do get hospitalized, we have an outlet to get them home earlier.
The OAC is moving ahead with the project because we fully recognize that heart failure is an epidemic. It isn't just a problem for the healthcare system, but this is an incredible burden on the patient and their caregivers and their life. And we want to be able to change that. We have to be able to change that.
What we know is that patients do better if there's shared care, meaning if their primary care practitioner is involved, if their nurse practitioner is involved, if their specialist is involved, and that they can share care with the patients.
The idea behind a Regional Hubs project is to provide care for the patient where the patient is by leveraging any expertise in the region and accessing expertise further down the line, very specific to heart failure, and provide that backstop for the patients.
We are the physicians who are trained in the management of congestive heart failure. We understand how to do it, and we want to make sure that A, we help our patients, B, we help other healthcare providers optimize the care for the heart failure patients in Ontario. And we know patients do better when they get access to immediate care.
We need to be able to manage patients where they live and call on the expertise where it's needed of people who have training in heart failure. Obviously, survival is incredibly important to patients, but what's also really important to patients is their quality of life. And Within the quality of life, it is how do I feel every day when I get up? Can I go to work? Can I engage with my family? Can I do the things that make me identify myself as an active, engaged member of my family and society? And anything we can do to improve that, patients will appreciate in a huge way.
Our healthcare system is strained in terms of resources, and we want to make sure that we spend every dollar and get the maximum benefit. We actually strongly believe that a project like this that aims at efficiency and effectiveness will actually decrease resource utilization. And in fact, will save the system money.
When you put together a program like this, you look to the literature which shows that early access to care, to the health team, rapid response for patients, early access post-discharge to the expertise, these have all been shown to enhance or improve outcomes for patients, and that's really what you draw on. It is the right care for the right patient at the right time, by the right person, and really that's what we're trying to do with the Regional Hubs project.
The system, it's going to be more efficient and effective. The dollar, it's going to be spent more wisely, and ultimately resources are going to be brought to bear where they're most effectively used.
Because you're contemplating a change in healthcare delivery, which may prove to be a better model for healthcare delivery, but because you're planning a change in healthcare delivery, there's a certain amount of funding that is required to actually make those changes and to enable those changes. And unfortunately, that requires a certain leap of faith that the actual hub is going to have an impact. But we have to look at delivering healthcare differently because currently, we're still not servicing the needs of the heart failure patient.
And so we're hoping to see that patients receive the care in the most efficient way possible. And as we know, hospitals, while necessary, provide very inefficient care often. It's a very expensive place to provide care. So we're hoping to see decreased hospitalization, we're hoping to see decreased emergency department visits, and we're hoping to see shorter hospital stays. Ultimately, we want every patient with congestive heart failure in Ontario to be receiving the best care they possibly can be received and getting the best care they can get.
So it should be a win-win for everybody. That's obviously the goal of the project.
The Ontario Association of Cardiologists represents the majority of cardiologists in Ontario and is one of the most informed groups on issues of cardiac health care in the province. The OAC believes there is tremendous value in engaging our experience and expertise to help close the gap that currently exists in Ontario's heart health care. If you agree that no life should be jeopardized and that the Ontario Association of Cardiologists needs to be part of developing cardiac care solutions, we ask you to please sign our petition.